In this case, zirconia BruxZir Esthetic now requires a minimum of 0.7 millimeters, so I typically reduce 1.5 to 2 millimeters to ensure there's space to fabricate beautiful anatomical crowns. Caries on adjacent teeth is best restored when access is easy and optimal as shown here. A core structure provides better retention for future crowns. Using a fine diamond round-ended tapered burr, residual cement is removed. Composite restorations are placed on 7 and 10 and buildups on 8 and 9 using 35 to 37% phosphoric acid etch for 15 seconds. Copious water rinse is done without desiccating the dentin. GLUMA is applied as a desensitizer to seal in the dentinal tubules and disinfect the teeth. Suction the excess and wait for the glossy appearance to disappear, which takes about 60 seconds. Be careful not to get any on the soft tissue as it can be an irritant and create bleeding. Next, I scrub in for 20 seconds Scotchbond Universal by 3M to create adhesion of the tooth to the restorative material. Air dry to thin layer for 5 seconds and light cure for 10 seconds. Omnichroma bulk and flowable are used as composite restorative materials. Finishing and polishing is quickly done using Sof-Lex finishing discs. Refined preparation of 8 and 9 is done using a long tapered fine diamond burr to create 2 plane reduction, 360-degree chamfer margin, and adequate lingual preparation to prevent under-reduction problems that may violate minimal thickness issues based on the final crown material. In this case, zirconia BruxZir Esthetic now requires a minimum of 0.7 millimeters, so I typically reduce 1.5 to 2 millimeters to ensure there's space to fabricate beautiful anatomical crowns. Kerr makes a bite tab that helps check that I have sufficient reduction. Keep in mind to remove any sharp edges from the preparation that may inhibit proper milling and create over-contoured bulky crowns. I again use Sof-Lex discs to even out my preps, polish the adjacent restorations, and provide guide planes for better path of insertions, and adjust opposing unsupported enamel chips. For tissue control, I use the 2-chord technique. The first chord, size 000, is placed gently into the sulcus for apical compression.